Hello, I'm Rob Bowman. On behalf of myself, Camille, Kellie, Anja and Gavin, I'll be presenting our paper titled Using Thematic Analysis in Healthcare HCI at HCI, a scope and review. In Healthcare HCI, we're interested in how technology can be used to support people with their health. To study this, we often conduct qualitative research. Qualitative research helps us understand people's experiences. We use this understanding to inform the design of future technology. Qualitative research involves data collection. This data may regard a range of topics such as people's experiences of a specific health condition, of existing healthcare technology, or of new healthcare technology. We may collect data for this in a range of ways such as interviews, surveys, or user reviews. There is then qualitative analysis, whereby we attempt to make sense of the data we have collected in relation to our research questions. For our analysis, we create some research outputs. These outputs serve to represent and communicate the experiences we were studying. Often, this output involves some sort of design insight. If our research is achieving its purpose, these outputs should be influencing the design of future healthcare technology, and in turn influencing people's experiences of health and care. As such, the success of our research is limited by how we analyse our data. Qualitative analysis is not simple. It involves skill, creativity, and interpretation. When analysing data, our own individual life experiences will impact how we interpret it. This means different researchers may interpret the same data differently. Differences in interpretation may in turn lead to different design insights. As people's experiences of health and care can vary hugely, in part due to systematic discrimination and inequality, these differences may be substantial. We need analysis techniques that allow us to effectively understand and represent the experiences of our participants, as well as to develop and communicate design insight from them. If we don't do this successfully, we risk negatively influencing the design of healthcare technology and even causing harm. The term thematic analysis, or TA, is used to describe a range of approaches for qualitative analysis. In recent years, the number of HCI papers on the topic of healthcare that report analysis termed thematic analysis has increased rapidly. This represents a change in research practice. Given the importance of analysis, this change is one that warrants careful consideration. Broadly, TA approaches involve coding of data and the creation of themes. However, they can vary meaningfully. For instance, they can differ by how differences in research or interpretation are accounted for and what constitutes a theme. In qualitative research more broadly, there is considerable discourse around how TA is being used. Central to this is a 2006 paper by Brown and Clark. This paper describes a TA approach that has become very highly cited. It is argued, however, that the approaches of many works cited in this paper are inconsistent with the approach the paper describes. So, what's the story of the rise of TA in healthcare HCI at HCI? This rise could suggest TA approaches can be very effective for healthcare HCI research. Researchers have chosen to use thematic analysis, and they have chosen to use specific thematic analysis approaches. We believe they've had good reasons for making these decisions, and seemingly more of us are making these decisions. If we study how TA is being used, we may be able to learn how to use it more effectively in the future. Something we should also consider is local norms. The publication of work using TA sets precedent for future work to do the same. This process can allow for norms to develop, norms that may not reflect good research practice. We need to be cautious of this and give norms careful consideration. This paper presents our work to understand the use of TA in healthcare HCI at HCI. From this, we've tried to learn how future work can make more effective use of TA. To achieve this, we conducted a scoping review, which is a rigorous and transparent literature review approach. The purpose of this review was to describe research practices. We were not attempting to evaluate work against some good practice criteria. We conducted our review informed by established good practice guidance. This included developing and pre-registering a review protocol. Our review covered a decade, 2012 to 2021, of HCI proceedings. We included papers that are on the topic of health or healthcare, and that reported analysis termed thematic analysis. 78 papers reporting 100 TAs were included. We looked at each paper closely and attempted to chart a large number of characteristics. At a high level, we wanted to chart what TA is being used for. Some questions this included were, what was the how focus? What was the HCI focus? What data was being analysed? And what was the output of the analysis? We also want to understand how TA is being conducted. Some questions this included were, what TA approaches are being used? How is data being coded? How are themes being created? How are researchers accounting for interpretation? And how are researchers collaborating? In addition, we want to understand how TA is being reported. What do researchers choose to report and what do they leave out? Ultimately, as this work is a literature review, everything is through this lens of what is being reported. We anticipated this work would be fairly straightforward. We are analysing research studying similar topics, using similar analysis approaches, published at the same conference. And as a principle of research, the research method should be clearly reported. In practice, the activity was challenging, and we had to adapt our analytic approach multiple times to account for the diversity of practices we were identifying. Our analysis was quite substantial. I'll share with you now a few of the highlights. From analysing the collected data, we found that TA is often being used to analyse interview data. We found descriptions of how TA being conducted were typically light in explanation or imprecise. Over half of the TAs were simply termed thematic analysis. 29% were termed inductive. Many papers cited a publication by Brown and Clark. Most of these citations were to the seminal 2006 paper. 23% of papers did not cite a source in relation to TA. There are a small number of citations to text on other TA approaches. It was often unclear to us how the data was coded and themes created. Conduct is widely framed as a team activity. Sometimes the involvement of multiple researchers is explicit, but often a we terminology, for example, we analyze the data, was used. To us, it was often unclear how collaboration was happening. Despite the large number of citations to the work of Brown and Clark, we found little reporting of research positionality or reflexive practice. Moving on to output. We anticipated that papers reporting thematic analysis would present as part of this themes. 20% of the TAs did not report themes. We also found that TA is often being used to generate design guidance. In our paper, we discussed 4 areas or opportunities to improve the use of TA going forward, informed by our analysis. We argue the importance of reporting TA practices. There are many reasons for this. At the very least, improved reporting is needed to enable readers to effectively interpret and evaluate research. In particular, we think there is a need for greater reporting of positionality and reflexive practice. We discuss the challenges of doing this and suggest some starting directions. Our review demonstrates TA is largely framed as a team activity, yet it is unclear how people collaborate. Again, there is a need for greater reporting. We perceive that there is a lack of guidance around how to conduct TA collaboratively. To inform researchers wanting to conduct TA as a team, we contribute to discussion of the strengths and challenges of different collaboration approaches. Finally, we reflect on the research fit of TA. We question if, given the type of data we often collect and the research output we often want, if Brown and Clark's TA approach is a good research fit. We consider alternative approaches. Thank you for listening.